Welcome back to the deep dive. This is where we dig into the research, the articles, all that stuff, to pull out the key takeaways, the things you really need to know. And today, we're looking at something, well, it might seem a bit niche at first, osteoarthritis in cattle. But stick with us, because what's fascinating is how it connects to bigger ideas about health, prevention,
Yeah.
and just how bodies, well, how they work, or sometimes how they break down. Our goal here is basically to cut through the complexity, give you the essentials on this without getting too bogged down. So let's kick things off right there. What exactly is osteoarthritis, OA? Is it like just a typical ache or something more serious for these animals?
Oh, it's definitely more serious than just an ache. Osteoarthritis is it's a chronic condition, progressive too. Essentially, you're seeing the cartilage, that smooth stuff on the ends of bones in a joint. It just degenerates over time.
Okay, the cartilage breaks down.
Right. But it's not just the cartilage. The bone underneath starts remodeling, changing shape. And there's inflammation in the joint lining, the synovium. For cattle, this means real trouble. Chronic pain, lameness, they can't move as well, and yeah, it hits their productivity hard.
That's a really important distinction. So we know what it is, but who gets it? Is it just old cows?
Yeah.
Or are there other, maybe surprising factors?
Age is definitely a big one. You see it most often in older animals, just from, lifetime wear and tear.
Makes sense.
But it's not only about age. Animals that go through repetitive trauma, maybe work in cattle with heavy loads, or even just, poor conformation. If their legs aren't structured quite right, that puts extra stress on the joints. They're much more likely to develop OA, too.
So it's a mix of aging, lifestyle, even genetics or build, perhaps. That leads us to the why. What are the sort of root causes driving this?
Yeah, good question. We generally split OA into two types. There's primary osteoarthritis. That's the one most people think of. It's basically down to age, normal wear and tear over a long time. The joint just gradually wears out. But then there's secondary osteoarthritis, and this is where specific underlying issues kick things off.
Ah, okay. Like what?
Trauma is a major one. Think about fractures that involve the joint, or bad ligament tears, dislocations. These things can change how the joint works forever, really. Sets it up for OA down the line.
Even years later.
Oh, absolutely. Years later. Then there's those conformational issues we mentioned, bad leg structure, putting constant abnormal stress in joints. That's a big trigger. And metabolic problems, too. Things like imbalances in calcium or phosphorus or other bone diseases can play a role.
Interesting. Now, you mentioned infections earlier, kind of briefly. How do they fit in? Can an infection actually cause a chronic joint problem like OA?
Yes, definitely. And this is a really crucial link. Infections, specifically something called septic arthritis, can absolutely be a major trigger for secondary OA.
Septic arthritis, so that's like an infected joint.
Exactly. A serious bacterial infection inside the joint. It's nasty. It causes incredibly rapid destruction of the cartilage. If it's not caught and treated aggressively, like right away, it can lead to permanent damage, permanent disability.
Wow.
And that damage, even if the infection clears, it paves the way for osteoarthritis later. It's a stark reminder that, an acute crisis needs immediate action to prevent long-term chronic fallout. Critical to catch it early.
Okay, so a bad infection can leave behind damage that then turns into OA.
Mm-hmm.
It really highlights how different problems can connect. When you talk about this breakdown, cartilage degenerating, bone changing,
Yeah.
what's actually happening inside the joint, mechanically, step by step?
Right. It's like a cascade effect. It starts with that articular cartilage breaking down. Normally, it's super smooth, provides cushioning.
Like a shock absorber.
Exactly. A shock absorber and a low-friction surface.
Oh.
As it wears away, it loses that ability. You get more friction between the bones. This increased friction signals the bone underneath to react. It starts remodeling, often getting denser, and this is where you see osteophytes' bone spurs forming.
Bone spurs.
Mm-hmm.
Are those the body trying to, stabilize the wobbly joint?
Yeah, you could think of it that way. It's an attempt to increase the surface area, maybe stabilize things. But ironically, these spurs often just make things worse.
That's so.
They can restrict movement, bump against other tissues, cause more pain. And meanwhile, you've usually got inflammation in the synovial membrane synovitis. That adds to the swelling, the pain, and actually speeds up the cartilage damage. It all leads to instability, less range of motion, and chronic pain.
Okay, so that's the internal picture. Messy. How does that translate to the outside? What signs would a farmer or vet actually see?
Well, the number one sign is usually lameness.
Limping. Obvious limping or subtle.
It can start subtle, but typically it's chronic and progressive, so it gets worse over time, especially with activity. Maybe seems a bit better after the animal rests. You might also see or feel joint swelling, puffiness around the joint could be fluid buildup, could be the inflamed lining. And pain. If you palpate the joint, gently move it, the animal will likely react, show pain. Reduced range of motion is another big clue. Stiffness. They might have trouble getting up or walking, turning, seem generally stiff.
Right. And I guess that affects behavior too.
Absolutely. You'll often see behavioral changes. They might be less active, lie down more, seem reluctant to move, sometimes even eat less because it's painful to get to feed or just because of the chronic pain itself.
Okay, so those are the clues. If you see those signs, how do you confirm it's actually OA? What's the diagnostic process?
It usually starts with a good clinical exam,
Yeah.
watching the animal walk, assessing the lameness, then carefully feeling the joints, checking for swelling, pain, heat, and that reduced range of motion.
Hands-on assessment.
Exactly. But the real confirmation often comes from imaging. Radiography x-rays, that's really the gold standard here.
What do x-rays show?
They can show those classic OA signs very clearly. Things like the space between the bones and the joint getting narrower because the cartilage is gone. Changes in the bone density, those osteophytes or bone spurs we talked about, and maybe signs of excess fluid.
Pretty definitive then.
Usually, yes. Ultrasound can also be helpful, especially for looking at the soft tissues around the joint ligaments, tendons, the joint capsule itself. And sometimes we might do an arthrocentesis. That means taking a small sample of the synovial fluid, the joint fluid.
What does that tell you?
We analyze it, look for signs of inflammation like high white blood cell counts or increased protein. It can also help rule out infection like that septic arthritis.
Right. So once you have that diagnosis confirmed, what's next? Treatment. Is there a cure or is it all about management?
Yeah, unfortunately, there's no cure for OA once it's established. The damage is, well, largely done. So the focus shifts entirely to management.
Managing pain, managing function.
Exactly. Improving quality of life. Medical management is a cornerstone. That usually involves NSAIDs, non-steroidal anti-inflammatory drugs.
Like bute or banamine or others.
Things like flunixin meglumine, which is banamine, yes, or meloxicam, they help reduce both the pain and the inflammation. Sometimes vets might use intra-articular injections, injecting corticosteroids directly into the joint, things like triamcinolone.
Does that help long term?
It can give significant relief, but it's often temporary, and you have to be careful about potential side effects with repeated use, like further cartilage damage, believe it or not, or risk of infection.
Tricky balance.
It is. There are also joint supplements, glucosamine, chondroitin sulfate. The evidence in cattle is maybe less robust than in, say, dogs or horses, but some people use them supportively. Then there's the non-medical side. Physical therapy, supportive care, that's huge.
Like what? Exercise?
Controlled exercise, yes. Not too much, not too little. Just enough to maintain mobility and muscle strength without aggravating the joint. Weight management is critical if the animal is overweight, less load on the joints. And simple things, like providing soft, comfortable bedding. Making sure feed and water are easily accessible so they don't have to walk far or struggle. It's all about reducing stress and pain.
What about surgery? You mentioned things like fusion.
Surgery is pretty rare in most cattle production settings, mainly due to cost and practicality.
Just not economical usually.
Right. But in very valuable animals, maybe breeding stock, show animals you might consider procedures. Arthrodesis, which is fusing the joint so it doesn't move and therefore doesn't hurt, is one option. Or maybe removing bone fragments. But yeah, for the average cow, it's typically not on the table. Management is key.
That makes a lot of sense economically and practically. So thinking about an animal that does have OA, what's the outlook? What's the prognosis?
It really varies. For mild cases, maybe moderate ones, if they get good management and pain control, the prognosis can be fair to good. They can live relatively comfortably for some time. But for severe cases, where there's a lot of joint destruction, the pain is really hard to control, maybe there are other complications, then the prognosis is much more guarded, maybe poor. It depends heavily on severity and how well it can be managed.
Which really brings us full circle to prevention. If management is tough and there's no cure, avoiding it seems paramount. How do you even try to prevent OA in cattle?
Prevention is definitely the best strategy, though not always foolproof. A lot comes down to good management practices. Environmental management is big. Good footing is essential, preventing slips and falls that can cause joint trauma. Providing ample dry bedding, just minimizing injury risk in their environment.
Okay, safe environment. What else?
Nutrition. A well-balanced diet is crucial, especially for young growing animals. Getting those mineral balances right, like calcium and phosphorus, supports healthy bone and joint development from the start. Regular monitoring is also key. Catching lameness or swelling early.
Before it gets really bad.
Exactly. Early intervention gives you the best chance to slow things down, manage it before severe damage occurs. And finally, avoiding overuse. For working animals, try to limit excessive strain or repetitive high-impact activities that put undue stress on their joints over time.
So good footing, good food, watching them closely, and not overdoing it sounds like solid advice.
Yeah.
We've covered a huge amount here, from the nitty-gritty of cartilage breakdown, bone spurs, right up to farm-level prevention strategies, and that link between something acute like septic arthritis and this chronic debilitating OA. That's really eye-opening. Shows how things are interconnected.
Absolutely. And it really makes you think, doesn't it? These principles we've discussed, early detection, supportive care, focusing on prevention, understanding those links between acute and chronic issues, they don't just apply to osteoarthritis in cattle. They apply so broadly, right?
Yeah.
Across animal health, human health, maintaining productivity. It really drives home how important it is to pay attention to the small signs, to manage environments carefully, and to think about the long-term consequences of injuries or conditions. That proactive approach is just, well, it's fundamental.